Hi, I'm Kieran. I'm an orthotist at ELHC and have been for the past 4.5 years. An orthotist is an allied health professional who specialises in the assessment, measurement, design and provision of orthoses. When you think of orthosis, you probably think of footwear. That is the bread and butter of the job. We do a lot of that, especially for diabetic patients with loss of sensation, where we're trying to prevent amputation and from them re-ulcerating. We also do a lot of orthosis for spinal fractures. We do spinal braces on the ward. We do helmets for head protection. We do boots and bar for clubfoot in paediatric patients. There's a whole plethora of different specialities that we see patients in, from MSK, diabetes, neuro. So orthotics is a really exciting time at the moment, especially with the digital technology that we've got now. So in our diabetic foot clinic, for example, we're actively scanning patients for footwear and insoles. We're also using in-shoe pressure mapping with our diabetic patients, so we can actively see where these patients are taking the most pressure inside the footwear, and then design the footwear and insoles on the adaptions to offload that, and then remeasure again afterwards to ensure that it's working. So a patient where I've utilised digital technology was with a lovely lady who had been bedbound for a couple of years, had gross ankle deformity, had lots of edema, and she couldn't stand to transfer, and this was her goal. And that's what orthotics is about. It's about setting individual goals with your patients to allow them to live the best life as independently as possible. And we supplied the footwear and insoles and a caliper, and now she's able to transfer. And this lovely lady sent me a thank you card that read, "Dear Kieran, due to your skill and diligence, you've opened the door to the rest of my life." And I think that epitomises what an orthotist does. And often you can focus on maybe the prescriptions that haven't gone well, but 90% of the time, you're really changing people's lives in this profession. And it takes that lady sending a card in to realise that.